My name is Gregor Henderson. I'm the Strategic Advisor for Mental Health and Wellbeing with Public Health England. And Public Health England are England's national public health promotion, protection and improvement body. And we also exist to help reduce health inequalities. It's been a great morning setting the context for the rest of the conference. And the conference is packed full of information and workshops around digital mental health for children and young people. So it's two brilliant topics together, the rising interest, absolutely, in children and young people's mental health, and the rising interest in digital opportunities and digital technologies to support children and young people's mental health, and also understand where some of the digital technologies may pose some kind of negative or a risk to children and young people's mental health. So the event is extremely important and extremely timely, and it's great to see so many participants and experts in the room debating both of these very important topics. What I was trying to outline this morning was some of what's been happening in government policy in England, particularly outlining the recommendations and the work that's being taken forward now with the Children and Young People's Mental Health Green Paper. And that's a joint green paper between Departments of Education and Departments of Health and Social Care. And they have three very, very important parts of that green paper. One is that there will be a mental health leader in every school across the country. Second, that there will be multidisciplinary mental health teams close to every school, so close to 8,000 pupils and roughly 20 schools. So these mental health teams supporting schools in doing their job in terms of supporting the needs and education needs of children and young people. And the third area is making sure that there are lower waiting times for children and young people's mental health services. So there's a massive, great big implementation agenda, and Public Health England is supporting a lot of that, but also supporting looking much more closely at the evidence for whole school approaches to mental health and well-being. And what I was outlining in my talk was the importance of seeing mental health in the round as part of overall health and well-being, but also learning about mental health as an essential life skill for future life, about being resilient, about dealing with mental distress and challenges in people's lives, and the dangers of not over-medicalizing everyday behaviors, but also making sure that we are able to spot and deal with and treat and look after those children and young people who are particularly challenged by mental health issues and whose everyday functioning is being severely affected. We need to do much better at supporting those with the greatest needs. So my job was to help set some of the policy context and to identify areas where we can do better, but also to applaud the direction of travel we're going in. And this afternoon there will be a lot more in-depth discussions about the possibilities and the potentials for digital solutions to these complex human challenges.